Okay, so for all of you UPSC folks out there,
Mm.
whether you're aiming for mains or maybe even thinking about prelims too, today we're diving into a really crucial area. I think the evolution and the present state of public health education and employment in India.
Absolutely.
And, think of this as like the essential background that you need
Yeah,
when you're trying to make sense of how our healthcare system is actually working on the ground.
that's a great way to put it.
And to guide us through this very, very important discussion, we have the Hindu.
A fantastic source.
All right, so let's just jump right in.
Okay.
Our main goal in this deep dive is to kind of map out, okay, how public health education has actually grown in India over the years,
Right.
and then pinpoint the challenges that graduates are facing right now, like today,
Yeah.
in finding jobs that actually fit their skills and expertise,
Absolutely.
and then explore, some of the potential solutions that are out there.
Exactly.
So we've seen in recent years just a huge surge in the demand for public health expertise,
Sirship?
which has naturally led to, pretty rapid expansion of educational programs.
Yes, definitely.
But as we'll see, this growth hasn't been without its complications.
Right.
What's really interesting here is this emerging gap.
Mm-hmm.
So we have a growing number of qualified public health professionals,
Yes.
but not enough clear or accessible routes to impactful employment.
A very critical issue.
So to understand, where we are now,
Mm-hmm.
I think it's really helpful to look back a little bit and see where this journey actually began.
That's a good point.
What would you say about the role of the British colonial era?
Well, I think it played a significant role in shaping the initial focus of public health education, wouldn't you say?
Definitely. Back then, the main concern was really about controlling infectious diseases
Right.
and improving sanitation.
Mm-hmm.
Public health wasn't really a standalone discipline,
No,
It was more of an addition to medical training.
Yes.
So hygiene, epidemiology, and disease prevention, these things were part of the curriculum.
Right.
But they definitely weren't the main focus.
Makes sense considering the priorities of the colonial administration at that time.
Right.
I imagine they were mostly concerned with the health of their own personnel
Of course.
and maintaining order.
Yeah.
Broader public health initiatives probably took a back seat then.
Yeah. They weren't at the top of the list.
But, even within that context, there were some important early developments. I think.
Absolutely.
Hmm.
I think a real turning point was when the All India Institute of Hygiene and Public Health was established.
AIIHPH.
Right. The AIIHPH in Kolkata back in 1932.
A landmark institution.
It really was, this was like a pioneering institution. And it was specifically dedicated to training people
Yes.
in hygiene, sanitation, and disease control.
Right.
But even with this, major development,
Mm-hmm.
public health education mostly stayed within the walls of medical colleges.
It did.
It became a part of what they called preventive and social medicine,
PSM.
right? PSM, which later, changed to community medicine.
Yes, that's right.
So for a long time, the way people saw public health was really through the eyes of doctors.
That's a good observation.
So now if we kind of fast forward to after India gained independence in 1947,
Right.
what shifts do you think happened?
Yeah.
Especially given all the massive health challenges that the newly formed nation was facing,
Huge challenges.
right? I mean, the scale of the problems was immense.
Absolutely.
We had widespread malnutrition, infectious diseases were spreading rapidly,
Yes.
and access to basic healthcare services was really, really limited for a lot of people.
It was a critical situation.
The government definitely launched a bunch of initiatives to try and expand healthcare reach.
They did.
But even then,
Mm-hmm.
training in public health was still mostly concentrated among medical graduates.
Right.
So while they knew there was a need for public health specialists,
Yeah.
the pipeline for training those specialists remained pretty narrow.
So it seems like the focus initially was more on direct clinical care rather than, actively building a dedicated public health workforce with a broader set of skills to manage health at a population level.
Exactly. And I think it wasn't until the 1970s and 80s that we started to see this landscape slowly broaden a bit.
Interesting.
So new institutions emerged, like the National Institute of Health and Family Welfare.
The NIHFW.
Right, the NIHFW in Delhi.
Right.
And this was set up to provide more advanced training
Okay.
in both public health principles and family welfare programs.
Important areas.
But even with these really important developments,
Mm-hmm.
the field was still dominated by community medicine specialists.
Yes.
So it was still lacking
Right.
those broader perspectives of social determinants, of health,
Right.
policy analysis and management, which are so central to public health today.
It sounds like the emphasis was still largely clinical,
He was.
even within community medicine,
Mm-hmm.
maybe missing those crucial aspects of addressing, the bigger societal factors.
Right.
Poverty, education, housing that have a huge impact on health outcomes.
Absolutely.
Those are areas where public health interventions can make a real difference.
And this brings us to a really important point in time, the early 2000s.
Okay. Turning point.
Yeah, because this is when Master of Public Health programs,
MPH.
right, MPH programs were introduced in India.
That's a big shift.
It really was. And things took a major turn here because these programs were no longer only for people with medical degrees.
Right. It opened up.
They opened their doors to graduates from all sorts of different disciplines,
Exactly.
social sciences, nursing, allied health professions, all sorts.
It was a fundamental shift, wasn't it? Moving away from that isolated medical perspective to a more integrated understanding of these complex public health issues.
Definitely. It really fostered that crucial interdisciplinary approach.
Yes.
So it wasn't just about epidemiology, the study of disease patterns.
Mm-hmm.
It also incorporated health policy and health management.
And how has the growth of these programs been?
Oh, it's been remarkable.
Really?
In 2000, there was only one institution in all of India offering an MPH.
Wow.
By 2024, that number had exploded to over 100.
That's an exponential increase.
It really is, and it shows that people are starting to recognize that public health is not just about treating illnesses,
Right.
but preventing them at a population level.
Absolutely.
So now we're seeing professionals from diverse backgrounds coming together to tackle these really complex challenges.
But of course, such rapid growth also brings its own challenges.
Of course.
Which leads us to the current situation.
Exactly.
What are public health graduates facing today?
So despite this massive increase in the number of graduates, the job market hasn't really kept up.
Interesting.
So we're seeing fierce competition for even entry-level positions.
Oh, wow.
Like research assistants or program officers.
I see.
The sheer volume of graduates is just way more than the available opportunities.
And what are some of the key factors contributing to this imbalance?
Well, the Hindu article points out a few things.
Okay.
One major reason seems to be the limited number of dedicated public health positions within the government.
The government itself.
Yeah. There's been talk about creating these specialized public health management cadres within state governments.
Right.
And this could really change things for employment.
It could.
However, these efforts have been slowed down by bureaucratic hurdles.
Oh, I see.
And these much-needed positions just haven't been created at the scale that's required.
So what kind of hurdles are we talking about?
Well, often it's about complex administrative processes.
Oh.
The challenges with coordinating between different departments.
Makes sense.
And maybe even a lack of understanding
Right.
of the specific roles and expertise that public health professionals bring to the table.
Their unique contribution to governance and policymaking.
Exactly.
Interesting.
And then we have the private healthcare sector,
Okay.
which is growing so rapidly in India.
Yeah, it's booming.
You'd think this growth would mean more jobs for public health graduates.
Logically, yeah.
But the focus there seems to be a bit different.
In what way?
Well, private hospitals and healthcare organizations,
Mm-hmm.
they tend to prioritize expertise in hospital administration
Right.
and business management
Okay.
over core public health skills.
I see.
So things like disease surveillance,
Yeah.
designing health promotion programs,
Mm.
and assessing community health needs.
Important skills.
So while there are management roles,
Right.
they might not fully utilize the specific training that MPH graduates receive.
Makes sense.
Now, what about research?
Research.
This often seems like a natural path for people with public health training.
It does.
What do you think?
Well, research organizations do employ a lot of public health professionals,
They do.
but a big chunk of their funding comes from grants
Okay.
from international organizations.
I see.
And as India's economy has grown,
Right.
it's not seen as a primary focus country for some of these funders anymore.
So that means,
Fewer research opportunities, potentially.
so we have a multifaceted challenge when it comes to employment.
Yes,
But the Hindu article also talks about the quality of education.
that's another key aspect.
Right, it raises some important questions there.
What kind of questions?
Well, the rapid increase in MPH programs, well, it's great that people are interested in the field.
Yeah.
It's also led to concerns about maintaining educational standards across all these institutions
I see.
in such a competitive environment.
Right.
Some institutions might feel pressure to lower their admission criteria.
To get more students.
Exactly.
That makes sense?
And then there's the quality of instruction.
Right, the teachers.
Yeah. This is another area of concern highlighted in the article.
So what's the issue there?
Well, in some of the newer or less established programs,
Okay.
faculty might not have the extensive training
Right.
or enough real-world experience in public health practice.
Which is so essential for effective teaching.
Exactly, and for mentoring students.
Oh.
And this can impact the practical skills and knowledge that students actually acquire.
That's a valid concern.
And here's something else that's really interesting.
Okay.
There's no standardized curriculum for all these MPH programs.
So unlike medical degrees.
Right, which are regulated by the National Medical Commission.
NMC.
Right, the NMC, or the University Grants Commission.
UGC.
There isn't a central body that ensures a basic level of content
I see.
and competencies for MPH graduates.
So this lack of standardization,
Yeah,
it leads to inconsistencies in what graduates know and can do,
exactly.
and it makes it harder for employers to really assess candidates.
It does.
It can hinder the professionalization of the field.
And then we can't forget about the geographical disparities.
Oh, right. Access to education?
Yeah, many large and populous states.
Like Bihar,
Jharkhand, Assam.
Okay.
And several smaller states, too. They have very few or sometimes no institutions
Yeah.
offering public health courses.
That's a major problem.
It restricts opportunities for people in those regions,
Yeah.
and it weakens the public health infrastructure.
Right, where it's often needed the most.
So we have this situation
Yes.
where the expansion of public health education is great.
In principle, yes.
It shows we're recognizing its importance,
Absolutely.
but we're facing these big hurdles
We are.
around jobs, educational quality standardization, and access across the country.
So what can we do about it?
Well, the Hindu article highlights some potential solutions.
Okay. I'm interested to hear.
First, creating more dedicated public health positions in the government.
In the government.
Yeah. The article points out that in countries with strong public health systems, the government is a major employer
Right.
of these professionals.
Makes sense.
So establishing clear public health cadres
Hydrate.
at state and national levels
Right.
could make a huge difference.
It could.
It would boost employment and strengthen our public health capacity
The things like,
for disease surveillance,
yeah.
health promotion, and effectively implementing national health programs.
That's a great point.
And it would give graduates a clearer career path.
Yes.
And then other key recommendation is regulating and standardizing public health education.
Okay, regulating how?
Well, the suggestion is to create a specialized regulatory body.
A new body.
Yeah, maybe under the NMC or the UGC,
Right.
but led by experts from the field of public health.
That makes sense.
So it raises the question,
Yeah.
how do we balance setting quality standards while still letting institutions innovate and adapt their programs?
To meet different needs.
Exactly, to address regional health needs or new public health challenges.
That's a really insightful point.
The goal wouldn't be to stifle innovation.
Yeah.
It would be to ensure a base level of quality
The foundation.
when it comes to the curriculum, faculty qualifications, training methods,
Yes.
and giving students real practical experience.
And speaking of practical experience, the Hindu really emphasizes stronger connections. Yes.
Between institutions and the workplaces,
Right.
government health departments, research institutions, NGOs.
It's all about bridging that gap
Exactly.
between theoretical knowledge and what happens in the real world.
Absolutely.
And to do that, we need more hands-on learning.
So
Internships, field placements, collaborative projects.
that would be so valuable.
It would make graduates much more competitive.
And then finally, addressing those geographical disparities.
Absolutely.
We can't leave anyone behind.
We need to encourage new public health institutions.
In underserved states.
Yeah, or introduce public health programs in existing universities in those areas.
Right.
And maybe offer incentives, scholarships, or guaranteed government jobs
In those regions.
to encourage people to both study and work where the need is greatest.
That's a great idea.
So to sum up,
Yes.
we've seen how public health education in India has evolved
From its colonial roots,
to the expansion of MPH programs.
it's a fascinating journey
It is, but we have these challenges,
around education and jobs
and addressing those.
is key
Absolutely.
to building a strong public health workforce.
So for our dedicated UPSC aspirants,
Yes.
what are the key takeaways here?
Well, understanding this evolution and the current challenges in public health gives you valuable context
Context.
for analyzing health policies,
Yes.
government initiatives, and broader development in India.
That's a good point.
This kind of nuanced understanding can really enrich your answers.
Especially in the mains exam.
Right. And even help you with those tricky prelims questions.
It can.
And as future civil servants,
Right.
you'll likely be involved in shaping and implementing health policies.
It's a crucial responsibility.
So a deep understanding of the public health ecosystem
The strengths, the weaknesses.
will be invaluable for making informed decisions.
Absolutely.
And contributing to a healthier India.
That's what it's all about.
So as you continue preparing for your exams,
Yes.
think about the long-term impact of having a strong public health infrastructure.
It's a critical question.
And what role do you see yourselves playing in strengthening this vital sector?
It's something to reflect on.
For more in-depth discussions like this to help you ace those UPSC exams, be sure to like this deep dive and subscribe to our channel.
Don't forget to subscribe.
We'll be bringing you more insights from top sources like The Hindu.
Fantastic.
And we'd love to hear from you.
We do.
So if you have any questions or topics you'd like us to explore in future deep dives, just drop them in the comments below.
We'll do our best to address them.
And just a reminder, the information and analysis we discussed today is based on The Hindu.
A great source.
Thanks for joining us on this deep dive.
It's been a pleasure.